Hello class! In this session, we're going to be talking about personal fitness programming. This is chapter 9 of the course textbook. Let's begin. Learning objectives. By the end of this module, you should be able to explain why a fitness program must be fit personal values, develop a comprehensive fitness program, identify common misconceptions related to physical fitness and wellness, describe how to properly hydrate and adjust diet to maximize exercise benefits, determine safety considerations for exercising, apply concepts for preventing and treating injuries, and describe the relationship between fitness and aging. Choosing an exercise program for you. An exercise program built around your values, what matters to you, what's meaningful to you. It always starts with asking yourself, what activities do you enjoy? Enjoyment is necessary for you to continue doing something, whether it's a job, whether it's a relationship, whether it's a hobby. You need to find enjoyment or enjoy what you're doing for the likelihood of that to happen again be higher. You also need to identify what elements of an exercise routine do you value. Meaning, are you trying to exercise to get stronger? Are you trying to exercise to stay healthy? Are you trying to exercise to lose weight, to be more flexible? You need to understand what are the elements of an exercise routine that are meaningful, that are of value to you. You also need to consider whether or not the activities align with your resources and time. The activities that you're choosing to do they align with your availability? Do they align with your resources and the time that you have to invest? You also need to think about the notion of convenience. You are students at HD. Is it more convenient for you to exercise outside of campus versus than exercising on campus? There's also the notion of social support. The people that support you, the people that may engage in activities with you. We know that the more fun the activities and the more supported you are in doing it, the more likelihood for you to be able to do it. And also the notion of flexibility. Sometimes we want to do some type of activities, but we don't have enough time to do them. So we need to be flexible in adapting to the options we have to try to stay active. Remember, some activity is better than no activity. Creating your exercise prescription. Everything starts with the basic exercise training principles. In this class, we have already talked about exercise training principles. We have discussed the overload principle, which is stressing the body, the progression principle, which is gradually increasing the stress or the amount of weight that we add to the body, the principle of specificity, which is training for specific goals. We also talk about the principle of recovery, allowing the body to time to adapt. And we also talk about the principle of reversibility, which is fitness decreases if training stops. But we also talk about other principles, like the intensity of the exercise, the duration or the time of the exercise, the type of activity, and the amount of volume and the progression. So we have talked about various training principles, and you use those principles to basically identify the activities, the amount of time you're going to invest in each, the amount of repetitions and intensity, the number of days. That's how you use the principles to help you identify what you're going to do. But there are other types of exercises that are very popular, like interval training. Basically, is using interval chunks of periods of time to engage in training with specific resting periods. A good example of interval training is called high intensity interval training, or HIIT, which has become very popular, specifically during the pandemic. There were many apps and videos of people doing high intensity interval training. And high intensity interval training, or HIIT, is a form of exercise that involves alternating short bursts of intense physical activity with periods of rest or low intensity activity. What are some of the key features of HIIT training? Intensity. HIIT sessions typically involve pushing the body to its maximum capacity for brief intervals, often lasting 20 to 60 seconds. The intensity in the intervals are interspersed with recovery periods that allow the body to partially recover before the next burst of activity. Usually, those rest periods are between 10 to 30 seconds. HIIT workouts can vary in structure, but typically they include a warm up, multiple rounds of intense intervals, and a cool down. There are some benefits with HIIT training. It has been shown to improve cardiovascular fitness, burn calories effectively, build muscle, and reduce stress. That's why they have become so popular. However, there are some important considerations when trying to engage in high intensity interval training. And the first is that it's not suitable for everyone. You must consult with your healthcare provider before starting a HIIT if you have any underlying health conditions. Beginners, people who are not exercisers, should start with shorter intervals and gradually increase the intensity and duration. HIIT exercises also require that you do proper forms, and the technique are crucial to avoid injuries. As always, with any exercise program, you must listen to your body and take breaks when needed. Periodization. Periodization is a training approach that uses a systematic variation in intensity and volume to enhance fitness and performance. Periodization is broken into three phases: macrocycles, mesocycles, microcycles. A microcycle is simply the long term training plan, the big picture. A mesocycle is the medium term block of training within a microcycle with specific goals. And the microcycle is the shortest unit, typically a week, that makes up the mesocycle. Simply, microcycle as those short training days or training weeks. Mesocycles are those periods where there is blocks of microcycles, usually lasting a month. And the microcycle might be the year-long training plan. This periodization approach is used for both aerobic and anaerobic sports. You will usually use periodization if you are trying to engage or participate in sport activities. Most sport teams use periodization as a way to train their athletes to achieve maximum fitness levels. And here's a graphic view of how this periodization might look for someone trying to increase muscular strength as part of their fitness goals. We have the mesocycle, we have the microcycle at the top being the long year plan, and then we have those mesocycles, and then within those mesocycles we have the microcycles. Preparing for sports participation. If your plan for your fitness goal is to engage in sports, then it is very important to recognize that sports participation is very demanding. It requires a great level of investment, particularly because it's better to get fit before playing sports. Most sports use a periodization approach, like I stated previously, and within those periodization plans, there are the periods when the person are going to be engaging in what is called pre-season, which is usually when they start putting a lot of effort and focus on developing good fitness. Then they have the in-season, that's when the sports games are taking place. And then they have the off-season. But as any sport program, there's usually some basic fitness conditioning requirements. Everything starts with assessing the athletes or pre-activity screening. We gotta know what they have and we gotta know what they need to work on. Then a lot of the training focuses on developing cardiorespiratory fitness, followed by developing strength and endurance, then flexibility, which hopefully will address and help them achieve proper body composition for their athletic requirements for their given sport. Sports specific training. Sports specific training should match the sports requirements for aerobic and anaerobic capabilities, muscular strength and endurance, and range of motion. That's why most athletic teams at the university level have strength and conditioning coaches who are responsible for identifying both the aerobic and anaerobic capabilities of the athletes, help them develop muscular strength and endurance, and range of motion. For any sports specific training, you must allocate at least 4 weeks of sports specific training before participating in any sport. That is at least 1 month of sports specific training. However, it is very important to consider sports specific training requirements such as stop and go sports. Those type of sports have specific demands, such as those sports who are participating in the fall have different demands than those who are participating during the winter because of climate conditions. Fall sports, the athletes usually endure a lot of heat exposure. On the contrary, athletes who participate in winter sports have to face extreme cold weather. Similarly, athletes who engage in athletic events that require them to cover long distances, like marathon runners, triathletes, their specific sport training is focused on distance training. Same as athletes who are engaged in gymnastics. There is more strength and flexibility training. So sports require sport-specific training to enable the athletes attain maximum performance by completing the tasks that are required of them as part of the athletic competition. Following your exercise prescription. Exercise considerations. One of the first things to consider when exercising is the time of the day. If you're not a morning person, don't schedule exercise in the morning because you're likely not going to show up. So you got to understand the time of the day in which you're going to exercise. Preferably, just because of physiology of the body, it is best to exercise in the morning before you do anything else. The reason being is you're not going to be tired, you're not going to be fatigued, and you're not going to be stressed. That's why most exercise experts recommend that people exercise in the morning. But what if you don't have morning available? We have discussed this in class already. Some activity is better than no activity. So the goal is to identify a time of the day where you can invest some time and effort to exercise. You also need to be able to identify the type of clothing and shoes you're wearing. Crocs are not good for exercise. Flops are not good for exercise. So it's very important that when you are identifying what to wear to exercise, that you select clothes that are breathable, that allow for proper sweating, and that are comfortable. And that you wear athletic shoes that are conducive for you to exercise. You also have to consider the climate in which you're in. We are in Central Texas that tends to have high heat and humidity. Therefore, if you are in the summertime, it's not the same to exercise during the fall or the winter. You have to be mindful about exercising during high heat and humid days because you're more likely to have heat cramps, heat exhaustion, or even a heat stroke. That's why hydrating is so important for exercise. You also have to recognize that exercising in cold weather have its own challenges. You may not get as thirsty, but that doesn't mean that you don't have to drink water. And then the exposure to the cold weather. And then there is the notion of exercising when you're sick. If you're not well, rest. Allow your body to recover. But sometimes some extreme exercises will exercise even when they're sick. Now you risk others to get ill by exposing yourself to people when you're not healthy. But nonetheless, these are some important considerations when exercising or planning to exercise. Hydration is extremely important, not only for our survival as human beings, but also for exercise. Thirst is not an accurate indicator of the amount of fluids that you need. There are some people who can exercise for a long time and do not drink water. And they might think that because they're not thirsty, they don't need water. That's a mistake that can lead to serious injuries. You need to drink plenty of fluids prior to exercise. It is recommended to drink 6 to 8 ounces of water every 15 to 20 minutes during an exercise. Cold fluids absorb more rapidly. That's why cold water is preferable when people want to drink something, because it's absorbed quickly by your body and it makes you feel that you are reducing the thirst rapidly. But it's just a mental state. That's something your body makes you feel like you are experiencing. That's why people prefer cold water, because the notion that it makes you be less thirsty, but it's because it gets absorbed more quickly by your body. Sport drinks not needed unless duration is over 1 hour. Many times people substitute water by sport drinks. Sport drinks have high sugar. It's a lot of high sugar content, and that's what's the problem with sport drinks. However, if you're exercising for more than 1 hour, you will not only need to hydrate, you will also need to add more carbohydrates to your body. So sport drinks are good when you're exercising for over 1 hour. Meal timing during exercise. How long should a person wait after a meal before exercising? It depends on the amount of food eaten. But generally speaking, it is advisable that you eat 2 hours before you exercise. Participating in light activity like a walk after a meal is fine and may help body metabolize fats more efficiently. In fact, it is advisable that if you take a short walk or even move a little bit after you eat a meal, will not only help you burn more calories, but it might help you metabolize that food more efficiently. Exercise related injuries. Exercise is movement, and it requires your body to move sometimes beyond its capabilities. So there are some consequences from exercising, like muscle soreness and stiffness. For people who have not exercised regularly, muscle soreness and stiffness is one of the reasons why they quit exercising in the first place. Because they have not been active, they start exercising and then they feel that they cannot move. Their muscles and their body are so sore and stiff that they feel that exercise is killing them. That is a physiological adaptation of your body. It will get better. But nonetheless, muscle soreness and stiffness are consequences of exercise. There is also the notion of shin splints, particularly for people who are runners. That is an inflammation in the lower part of your leg that can be very painful. Certainly muscle cramps, which most everyone have experienced at least once in their lifetime. They're very painful depending on the severity of it, and can take you away from doing stuff that you like. There's also sports injuries, as we know, as any body movement, you are prone to getting injured if you're not doing properly. So there is this notion of acute sports injuries, particularly joint area, knee injuries, ankle injuries, pull muscles are examples of acute sports injuries. Athletic training experts recommend that whenever you are dealing or treating an athletic injury, that you apply the RICE principles. The R stands for rest, meaning if you're injured, you rest because you gotta allow your body to heal. You gotta see a medical practitioner to know the extent of your injury. But everything starts by resting. Then the application of ice. Ice is a vasoconstrictor. It reduces the amount of fluid going to that area. Therefore, the inflammation is less. The period to recover is quicker. And once you apply ice, you have to compress. You have to put some bandaging to keep the ice in place. And then elevation to reduce the amount of fluid going into the injured area. Now, this RICE principle is done by, it's applied to injuries that do not have lacerations or broken bones. Lacerations means that there is open skin, that there is a cut. You don't want to put ice on a cut. It can be very damaging. Therefore, you don't also want to put ice on a broken bone. It can be very damaging. So the RICE principle are for, twisted ankles, hyperextended knees. Again, these are done to reduce the amount of swelling to the area, so it allows for quicker recovery periods. Ice is the best friend of athletes. If you're an athlete and you have participated in sports, you understand how good ice it's for you. That's why there is so many new places today offering cryotherapy. And cryotherapy is simply a very cold room in which the athlete goes in for 1 to 3 minutes just to get full body cold, like if you were submerging yourself in ice. Here's a list of various common exercise related injuries. You can find this table in your course textbook. Adapting exercise to health circumstances. As we know, people have chronic health conditions that they have to coexist with, like diabetes, asthma, arthritis. For people who have diabetes and want to engage in exercise, it is very important that they check their blood glucose level before and after exercise. That they do not exercise alone, because if their blood glucose levels are very low, they might faint. And if their blood glucose levels are too high, they might faint. Aerobic and strength training exercises are recommended for people with diabetes, but moderate intensity, a minimum of 150 minutes per week. They might also experience something called exercise-induced hypoglycemia. And that is that they experience high peaks of glycemic index because of the exercise. The body is trying to store glucose to create and use energy for the body to move, which can result in experiencing exercise-induced hypoglycemia. And again, this must be checked, and the person must be always working with somebody else just for safety precautions. Similarly, individuals who have asthma, exercise is good for asthma, but exercise can also induce asthma attacks, especially if you're working out in areas where there is high levels of pollution. Very important to be mindful about exercising if you happen to have asthma. Avoid humid areas, avoid high polluted areas, and as always, have your pump and your medication with you ready, available in case that is needed. Benefits of regular physical activity for older adults. Physical activity is good for anybody. It is the one medicine that you can use anytime without a prescription. Physical activity reduces the risk for cardiovascular disease, stroke, hypertension, type 2 diabetes, obesity, some cancers, and osteoporosis. So it has physical health benefits. But it also has mental health benefits by reducing anxiety and depression. It's also good to reduce dementia and Alzheimer's disease. It will not prevent it, but it will delay the onset of those mental disorders. Physical activity also improves or increases functional capacity, overall health status, memory, and longevity. That is life expectancy. Physical activity has multiple health benefits. That's the reason why, from a public health perspective, there is great emphasis on promoting physical activity among everyone in the population. In summary, for the best chance at success, choose exercise that aligns with your values and resources. Select an activity that you enjoy, that reflects the rewards you value, and that fits the time and resources you have available. Exercise prescription should be based around the principles and recommendations for the cardiorespiratory fitness, muscular fitness, and flexibility. Sport specific conditioning should match the sport's requirements for aerobic and anaerobic capabilities, muscular strength and endurance, and range of motion. Physiological improvements in fitness and conditioning programs occur during the rest periods following training. Proper nutrition and hydration practices are a critical part of any training program. Disregarding them will slow down fitness improvements and speed the onset of overtraining. Hydration is fundamental for successful exercise training. Drink plenty of fluids prior to prolonged exercise. Drink 6 to 8 ounces of water every 15 to 20 minutes during exercise. A standard treatment for acute sport injuries is rest, ice compression, and elevation. That stands for the acronym RICE. The main objectives of fitness programs for older adults should be to help them improve their functional status and contribute to healthy aging and longevity.